In today's Eye on Health, we're talking about leg swelling, what causes it, and when someone should worry about their swollen legs. We're joined by Dr. Jeffrey Miller, founder and CEO of Miller Vein. All right, thank you so much for joining us. And now there's different types of leg swelling, right? Everyone's looking at this now thinking, oh my gosh, my legs are swollen.
Yeah, and I like to separate it out into acute and chronic swelling. So acute means sudden onset. Chronic, it's been around for a while. And I think it's really important for viewers to understand that acute swelling, it needs to be seen immediately. Typically, doctors can make the diagnosis, history, physical, maybe some lab tests, and they can make a diagnosis quickly. But the thing that is really important to understand is acute swelling, it's a blood clot until proven otherwise. So definitely get seen right away. Then we move into chronic swelling, and those are the types of patients that we see every single day. So the most common cause of leg swelling is a thing called chronic venous insufficiency. So that's when a vein inside your leg, instead of carrying blood up like it's supposed to, valves don't work and blood is allowed to go the wrong direction, pooling of blood in the leg, fluid escapes, and then you get leg swelling. A couple of other conditions that we see regularly, lipedema and lymphedema.
Your lips?
Now, that's the thing. People are always like, what, lipedema? My swollen lips? So we're talking about legs here. Actually, lipedema refers to the maldistribution of adipose tissue, fatty tissue. And I will tell you, I have actually had patients cry in my office because they get seen, doctors are telling them, you know what, just lose weight. And in a sense, they're fat shamed. Mm-hmm. And lipedema, it's not because a person is obese, it's because they are predisposed to having maldistribution of fat. It's going to the wrong places. The way to see or understand what it looks like in terms of lipedema is the feet and hands tend to be spared. So in a person that has lower extremity lipedema, what we'll see a thing called the ankle cutoff sign. So the leg is really big, and then all of a sudden the ankle becomes totally normal, the foot looks normal. And it's a painful condition. In fact, years ago it used to be called the painful fat syndrome. Oh, obviously, gosh. We did away with that term. It's called lipedema, and it's very common. It's up to 11% of women, post-pubertal women. Maybe even 17 million people are affected. Lymphedema is kind of the opposite. So, you know how I said with lipedema, big leg, normal feet. Lymphedema is the opposite. So now the feet and the toes are affected. So the term pillow feet or sausage toes those are terms that are thrown about. So that the swelling is really getting to the ends. And that could be primary or secondary. Primary lymphedema is not that common, about 10% of patients. Secondary lymphedema, extremely common. The chronic venous insufficiency is actually the most common cause of secondary lymphedema. But anything that damages the lymphatics, these tiny vessels that get fluid out of our legs, anything that damages them can cause this thing called lymphedema. So trauma, tumor, surgery, radiation treatment, those are the types of things that we look for. Obesity can also affect the lower extremities and actually cause lymphedema as well. And since obesity is an epidemic, it's a common cause of lymphedema. And so you're looking down at your leg.
No. I just wanted to add that if anyone has any issues or they're wondering, just check it out with your doctor. Of course,
absolutely,
right? Someone
absolutely.
like you. Thank you so much, Dr. Miller, for joining us and sharing all that information with us.